Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health. Diabetes is on its own a problem. I know that most of the patients who do have diabetes know this fact as well, and their relatives do know this fact as well. But the problem of diabetes with the eye is to be considered as one of the major problems that diabetes would have effects on them, on the eyes. And of course, the eyes are very precious, and when diabetes do have effect on the eye, we are in a serious problem. With us today is Dr. Fahim, consultant of ophthalmology, Ain Shams University, Cairo, Egypt, to talk to us about what does diabetes to the eye. Dr. Tamer, thank you very much for coming today.
Thank you for the invitation.
Diabetes. I know that when somebody has diabetes, they do expect to have some complications, some problems. And one of the very major things that they should take care of are their eyes, not to be one of those complicated areas with the diabetes. So to jump to the complications, what does diabetes do to our eyes?
At the first, diabetes is a very common disease.
Yes.
And in Egypt, it represents about 10% of the population have diabetes. The problem in diabetes is the uncontrolled diabetes. We have a different complications, we affect a different structures in the eye.
Yes.
Maybe the first one is the lead. And the patient be complain severe ocular pain and severe pain. Now in this picture, we can see the lead is inflamed. It's red, and start to what's called the inflamed to happen. What's happened? It's what's occurred the sty. And this sty is an abscess inside the lead. It's associated with severe throbbing pain, and the patient is in pain he cannot tolerate. And this pain will never stop unless the diabetes is controlled, and unless it is treated well according to the ophthalmologist.
So it happens over and over again. When you clean it, just comes back again if you do not control the diabetes.
Yes, it may recur at any time and recur at a different site inside the lid.
Yes.
And sometimes not the abscess will happen. Maybe happen what is called is chalazion. Is chalazion just inflammation inside the gland inside the lid? We have a certain gland inside the lid is called meibomian gland. It's a lipid gland.
Yes.
Just it produce what is called a lipid material responsible for the tear film stability. And this is the gland when it's obstructed. When this happens with the diabetes, just inflamed, this swelling like this, and it's called what is heaviness. As you see in this picture, heaviness, and the eye will start to occlude. This patient will never just have a pain unless it's infected, unless inflamed.
Yes, that's quite scary actually to our viewers. But what do we do when we get that?
Just only you have to ask patient to treat the diabetes and control diabetes. This is the first things. And we start with him with the medications. Some antibiotics is given for him as like topical eye drops and ointment, and will send about 1 week. Most of the cases will be resolved unless the patient neglect this situation for about 1 month. And this situation we have to interfere by surgical.
You have to open this?
Yes, but it's opened from the inside.
From the inside?
Yeah.
So it wouldn't show up for the skin or skin scar?
No, never, because we open it from the inside the eyelid, from the inside, what's called the conjunctiva.
So if we go a little bit further than the eyelids into a deeper layer of the eye, what would it do?
If we go more deeper to this, we have what's called the lens.
Yes.
Yeah. And the lens, it is a very important structure. As we see in this picture, the lens is a structure present in the middle of the eye, responsible for the focus of the image to fall in the retina, especially on the macula. The lens is completely clear and it's very transparent. But what's happened in diabetes, some opacity happen inside the lens, and it produces what is called the cataract. And if we see the picture, in the first one, the image is clear. But when the cataract happens, the light will be scattered and the image will be blurred.
Yes,
and the patient will be start to suffering from something like this. And this just happened, the cataract already is happening for the old patients above 50. But if you have the diabetes, may occur more earlier than this and may happen at the 40 years old.
So that could start as early as 40 years.
Yes.
If the diabetes is not
controlled.
So what do you have to do for the cataract?
Once we have a cataract, we have to remove it.
You have to take
take it off. That's why we have to do cataract surgery.
Yes.
But now the approach for the cataract surgery is become more advanced. The previous we do open surgery. Nowadays we do just what's called the phaco, just very small incisions, through which we can go to aspirate this lens, and we can introduce and inject what is called, or plant what is called the intraocular lens, which replace the normal crystalline lens, and the patient can see very well after that.
But shouldn't we worry when the patient has reached to cataract at the age of 40? This means that the diabetes is not really controlled.
Yes.
That if we do an operation, the failure rate or the complications from the operation will be higher than the usual cases?
Of course, but we'll never operate the patient unless he controls diabetes. We'll never go to the OR unless he controls diabetes.
Yes, so it takes us to the square zero. You have to control the diabetes all the time.
No, we cannot interfere unless the patient is controlled diabetes.
One of the common problems that would happen, that I personally know some people have developed with diabetes, is the glaucoma. What is the glaucoma?
The glaucoma is a triad between three things will happen inside the eye.
Mm-hmm.
The first one, increase what is called the intraocular pressure. The eye, like a bowl, is filled with the fluid. This fluid is maintained in certain pressure. It's variable from the person to the person. It's ranging between 15 to 21. Okay? Yes. But sometimes this pressure will increase and become above 21.
Mm-hmm.
At the same time, the second point of the triad is the optic nerve, which is a very important structures, is collect the data from the retina, which is a very thin part, and we'll discuss later.
Mm-hmm.
This part is responsible for transmit the image from the retina to the brain. And when the intraocular pressure is increased to the level that may damage the optic nerve, the patient starts to lose the vision. And this is the third point of the triad. The patient starts to lose the vision, and the visual field starts to be constricted. So the glaucoma, to be diagnosed, we have the three important factors what must be happen. High intraocular pressure, optic nerve damage, and even visual field affection.
So apparently it's a serious disease if it develops. So how do you manage this problem?
The management is so easy, but if you discover it early, because the problem what we have, the optic nerve is a very important section from the brain. And once it's damaged, we cannot replace it.
Retrieve it again, yes.
So we try to preserve the optic nerve as much as we can. So once we have intraocular pressure is high, we give him the medication to reduce the intraocular pressure.
How would somebody know that the intraocular pressure is high?
I'm sorry, in the glaucoma, most of the cases are asymptomatic. And and discovered accidentally when the patient complains just coming to the clinic to change his glasses, or maybe have any other problems, and accidentally we discover high intraocular pressure and optic nerve is suffering from this. Or maybe the end stage when the patient loses the vision, or the patient very contracted field. That's at this stage the patient will come and ask for consultation.
There is nothing in between that would warn the patient? No.
There is something is very vague, like headache, sometimes intolerance to the light. Maybe he cannot see very well in the dark. But this is the problem. All of us have the same complaint. And the different problem, the different disease have a headache. Maybe reduce a headache like the hypertension, maybe a change of the refraction, maybe even toothache. All of them have reduced headaches. So there is no specific symptoms for the glaucoma unless the end stage would start to happen severe headache with the red eye and associated with vomiting. In this stage, we have to focus on the eye.
Yes, and you have to interfere as soon as possible. So somebody with diabetes, we have to give them the message that you have to go to the ophthalmologist, and you have to, of course, you wouldn't be needing to ask them to measure the pressure. Just tell them that you're diabetic, and your ophthalmologist would surely do the measurement of the intraocular pressure.
The routine will be done for every patient, even if he is diabetic or not diabetic, in order to check the intraocular pressure.
Exactly. So when you diagnose somebody with glaucoma, what do you do for them? Either it's in the end stage,
no,
or in the on the early stage.
Some of the cases we discover them very early, and just we give him the medication. This is the medication. The glaucoma, it is as we mentioned, the high intraocular pressure, it is the balance between aqueous production, the fluid inside the eye is produced, and the aqueous drainage. Okay, if the aqueous production is increased beyond the drainage, then the intraocular pressure will be increased. So we'll give him some medication to reduce this production, so that the balance will train back to the normal.
Yes.
Or give him medication help the drainage to be faster, and this will help the intraocular pressure to reduce.
Yes.
If this failed, the medication, we have to shift to the surgery. And the surgery, it is different the modalities of the surgery we can give him to the patient, but whatever it is, we induce or initiate another subway, different pathways than the normal aqueous drainage to help the drainage of the aqueous, or maybe facilitate the aqueous drainage.
All right, so you decrease the pressure by just letting the fluid go out.
Yes.
Okay.
Yes.
So we have a short break right now, but after we come, you'll be telling us more about what the diabetes does to the eye. Brothers and sisters, we'll be just going out for a short break, and please don't go away. We'll be talking more about diabetes and the eye. Until then, Assalamu alaikum wa rahmatullahi wa barakatuh. Dear brothers and sisters, Assalamu alaikum, and we're back, and we're still talking about the effect of diabetes on the eye. With us is Dr. Fahim, consultant of ophthalmology at Ain Shams University, Cairo, Egypt. Dr. Tamil, we've talked about parts of the eyes and what does the diabetes do to them, and of course some of them are really serious complications that should worry the people with diabetes to take care of their diabetes on its own first, and to take care of their eyes. If they have any, even the slightest symptoms, they should consult the ophthalmologist, or even they should consult the ophthalmologist without having complications. They should not wait to the...
We hope that. We hope that.
Exactly. So before we continue with the complications of diabetes on the eye, or the effect of diabetes on the eye, I want you to tell us, why does the diabetes on its own as a disease affect our tissues like this and lead to complications?
As you know, the diabetes is uncontrolled, or the diabetes have a high glucose level inside the blood.
Yes.
And once we have a high glucose level, that means the cells will suffering from the defect in the glucose to go inside the cells to be used.
Yeah.
So the metabolism and will be impaired. The metabolism is very critical for different structures. For healing, this will be affected. That's why the diabetic patient will have a wound, even after the surgical wound, the healing will be delayed.
Exactly.
And,
yes.
and we have to control the diabetes before any operations.
That's very true.
The second problem is once the metabolism is impaired, inflammation will happen inside the cells. That's why a different inflammatory material may be induced and may initiate a certain inflammation inside the lid, for example. And this disturbed metabolism may be associated with some leaking from the blood vessels, or even the small blood vessel may be occluded. But we have to mention something. Diabetes have a major triad. It's called diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy, which mean the diabetes affect on the three important structures: the eye, especially the retina, the kidney, and even the brain.
Yes.
And we consider the eye as the image for all of this. What we see in the blood vessels on the retina and what we see inside the eye is the typical what happened inside the kidney blood vessels, and the typical what happened inside the cerebral blood vessels. So the eye is very important to us to be examined and to show how the stage of diabetes happened.
Yes, it tells us what other organs, what happens in the other organs as well. Yes. So back to the eye and back to the effect of the diabetes on the eye. We've stopped by at the stage of glaucoma, where the glaucoma could cause a major problem if we do not interfere as early as we could, and we might need to do an operation to shift the fluid together with the pressure outside the eye to decrease the problem. What else do we have as a problem?
We have something is very easy for the patients, or something maybe noticed and maybe passed unnoticed, which the patient may have some blurred vision for sometimes in the day, and later on become clear. And we don't know what's happened. I can see now, but after 1 hour or even 2 hours, he becomes see. What's happened is just only the blood glucose level is fluctuating inside the blood.
Yes.
Yes, and at the same time, the refraction of his eye is changed by this blood glucose level.
At the time of the change.
Yes.
How's that? What's the link?
Something is called the glucose when it's high in the blood. It will be high inside the eye and will shift the fluid from the eye to the lens, which is very critical, which is very important for seeing.
Yes, making the lens more swollen.
More swollen, and this may change the refraction. This will be focused inside, in front of the retina instead of the focus on the retina. And the opposite will happen with be hypoglycemic. The lens will be very thin. That will be focused the image behind the retina, and the same will be blurred. That's why when the diabetic patient come to my clinic and ask for the glasses prescription, I do him the glasses, but I ask him at the same time to check the blood glucose level once he go outside my clinic. If his blood glucose level high or uncontrolled, don't do the glasses. You have to wait until the controlled diabetes and go back to me, and we'll do another glasses for him.
That's very important, because many of the people would go and do the glasses after wearing them for some time. They tell you, I'm not really satisfied or not happy with the new glasses. I can see
by these new glasses, and I have to change it and go to another doctor and change the glasses, and at the same time I can see that now.
And probably they have some incidence of diabetes and they don't know yet.
Yes.
So
this is one of the problems that happen with diabetes. Another problem is called the uveitis or even iridocyclitis. This iridocyclitis is inflammation from the middle layers from inside the eye. The layer is mainly vascular, and the blood vessels inside it is very important to nourish the retina and nourish the different structures inside the eye. But once it's inflamed by diabetes, it starts to leak. But it leaks fluid, and it leaks some inflammatory materials which induce some inflammation inside the eye. And this inflammation associated with pain, associated with the drop of vision, and the red eye.
The red eye as well.
Yes. And just only the complaint, the patient just, I have a drop of vision, I have a red eye. Can you give me just decongestant or some medication? But the problem is not just a red eye. This is what's called the inflamed eye.
Yes.
And you have to treat it very well, associated with the treatment or control the diabetes.
That's very interesting, because, as you said, somebody would think this is just dust came into my eyes, and even if it recurs or happens more often, they wouldn't really think that it might be linked to the diabetes. So,
yes.
So this is one of the very interesting notes that we have to give to our viewers.
That's why any patient would have a red eye, you have to consult the ophthalmologist, not pass unnoticed, and even take another drugs, because sometimes if you go to the pharmacy and will give him decongestant, sometimes give him a certain eye drops contain the steroids. It's harmful to the eye. You cannot continue on the steroid for a long time. This will initiate cataract or even initiate glaucoma.
Yes. So some
it's
people
better
would
not to ask the pharmacy to take a drug.
Yes, this is a very common practice, unfortunately.
Yes.
So yes, this is very important. So this brings me to the retina, as you mentioned earlier, which is the most important structure that's affected by the diabetes.
And one of the major complication of diabetes.
And one of the major complications, the retinopathy, as you mentioned earlier.
Yes.
So tell us about the retina. What does it do, and how is it affected by the diabetes?
As we mentioned, the retina is very transparent and delicate structures. It is responsible for transmission or initiation of the image to be transmitted through the optic nerve to the brain.
Yes.
If the retina is affected, the vision will be affected, and the patient will complain. The problem what we have in diabetes, if it's uncontrolled, some change will happen in the blood vessels of the retina, and this blood vessel may leak or even may close. Once it leaked or closed, the change happen inside the retina will affect the vision and start the patient to complain, and may progress to degree that will induce marked drop of vision, and the patient may lose the vision. And this what's happened in the retina. It's similar to what's happened, as we mentioned before, to the kidney blood vessels and to the cerebral blood vessels. So the patient may have a stroke at the same time. And some patient may have a renal failure associated with diabetic retinopathy. And even the renal failure may progress the diabetic changes and may pass from one stage to the advanced stage.
Yes.
So the diabetes is a complications, multiple complications, but at the same time is a chronic disease. We have to respect the disease in order the disease respect the human being.
Yes. We should probably have one of the episodes, later episodes about the retina, because of course we're running out of time. It's a big problem, and it's a serious problem if we do have all these problems or complications that you've mentioned. But I needed to give some advice to our viewers, those who suffer from diabetes and even those who do not have complications in their eyes, how to protect themselves from developing eye problems with the diabetes.
At the first, once we have diabetes, you have to go to the endocrinologist and to control your diabetes.
Yes.
Not depend on you, just only you take the treatment or take the medications. Because if you take the medication, may even not produce a very good control.